Alright. I'm sure you guys have all heard about the Ice Bucket Challenge. In fact, you might have even done the Ice Bucket Challenge. The Ice Bucket Challenge has brought the ALS disease to the attention of everyone across the United States through Facebook and YouTube and all the other videos out there. But do you really know what ALS is about? Imagine that you can think, you can feel, you can learn, you can have emotions, but your muscles just don't work the way they should. You can't walk, you can't talk, you can't eat the right way, but yet your mind is still going like you and I. ALS, your muscle function quickly diminishes as soon as you are diagnosed. It's quickly lost, but it's a slow and painful death. Our Uncle Greg was diagnosed with ALS in 2005, and I'll never forget the first weekend that we noticed. He was visiting for the weekend, and he was limping. His leg was just stiff. It was his calf that was stiff. And we asked him what was wrong, and he didn't know. He said it just had started bothering him, and he couldn't really use it the way he should, and that he had made a doctor's appointment to go figure out what it was. Of course, quickly he was diagnosed with ALS. Within 2 years, he was in a wheelchair, and he couldn't walk, he couldn't feed himself, he couldn't function with his arms. He was basically in a wheelchair and had to be pushed around and fed by his wife. Just a few months after that, he was called to heaven before his first grandson was even born. ALS stands for amyotrophic lateral sclerosis, and it's also known as Lou Gehrig's disease, named after the famous baseball player that died from it. It affects the nerve cells in our brain. There's transmitters within our brain from our nerves. One nerve sends a transmitter to another nerve. So our nerves in the brain will send the nerves responsible for working our muscles the message, and it makes our muscles move. But within people that have ALS, those transmitters don't work because the nerves they just basically disintegrate, and they don't work anymore. According to Marilyn Summers in Diseases and Disorders, more than 30,000 people in the United States are living with ALS, and every year 6,000 are diagnosed. So that's how quick, or there's only 30,000 people living with it, but every year 6,000 are diagnosed. It's not a very long living disease. So the Ice Bucket Challenge has really drawn awareness to ALS, but we can better understand it by understanding the symptoms, how it's diagnosed, and how it's treated. According to the amyotrophic lateral sclerosis fact sheet online, the very first signs are pretty mild. You'll barely notice, like I said, our uncle, he kind of had that calf issue, but you'll notice cramps, muscle weakness, stiff muscles, slurred speech. It can affect his speech right away, or they'll have difficulty swallowing or chewing. And it starts different in every single person. And it's called different for every person where it starts. So if it starts in a limb, it's called limb onset. And if it starts within your speech or swallowing, it's called vulvar onset. And then so once it's in your body, it quickly spreads. It'll start just in that one spot, but then it starts affecting all the other areas in your body that it affects. So, like I said, walking, moving your arms, speaking, and then it also will cause issues within your body. So a lot of them suffer from acid reflux because the muscles in our esophagus aren't working the right way. And then things like constipation because the muscles in our digestive system aren't working the same way. And eventually those with ALS die due to respiratory failure because the muscles in the lungs are not working, or they aspirate, which means that they choke. The signs and symptoms they sound really, really easy to notice, but they also mimic a lot of other diseases, so it's kind of difficult for doctors to to diagnose it. So it's basically a physician will look at the signs and symptoms that you're experiencing and will decide, does this look like ALS? And then they'll go on and move on to other tests that will test the upper and lower neuron signs within your body. There's tests like the electromyography, which basically is just seeing how your muscles work. It's like they'll hook your body up into different areas and it sees how your muscles react. The nerve conduction study, which is how the nerves are working in your brain. And then of course they'll do MRIs on your body, so that way they can kind of rule out other things. But it can be difficult to determine if that's what it is or not. And once you're diagnosed, it can be really hard because there is no treatment, there's no cure for the disease. According to Marilyn Summers, most ALS patients only live 3 to 5 years once they're diagnosed. There are others that can live up to 15 years, but those are more mild cases, and that doesn't happen very often. There is one drug called Riluzole, and it doesn't reverse any of the signs, but it will help prolong and slow down the signs by only just a few months. So it's not a very aggressive drug, but it does help some for a little while. The main treatment for patients with ALS is just making sure they're comfortable and helping them with getting around and making life a little easier for them. Equipment is huge. Most of them will end up in a wheelchair or in beds. And so there's wheelchairs, ramps, lifts that are especially designed to lift and help a patient at home with his family, if it's his family taking care of him, or in a nursing home. They'll actually lift the client for them so they're not trying to do it themselves. And then of course there's special speech equipment like computers that will help them speak longer and try and communicate. And then of course towards the end, when they're close to death, there's equipment that will help them breathe better or make their muscles a little stronger. They will also be treated with other drugs, not for the ALS specifically, but maybe to help with pain or depression, because a lot of them become depressed because they're living a death sentence, basically. Other things like the acid reflux and the constipation, they'll be given medication to help with that. And then physical therapy is also prescribed just to help strengthen the other muscles that are still working to help compensate for the ones that are not. So living with ALS is obviously very, very difficult, and the family around those that are living with ALS, it's very difficult. They will be the ones that are their main caretakers and trying to help them live the best they can for those last few years. But as us knowing the symptoms and how it's diagnosed and how it's treated can help us better understand the disease. But the next time you see an ALS bucket challenge, you'll understand what it's all about, and maybe someday we'll actually have a cure for it. Thank you. That's way longer than I assumed.